I'm 𝗂𝗍 𝗂𝗍, and I believe that seniors should not be ripped off or misled or scammed when it comes to their health care. It's the most important thing that you can decide on once you're into the Medicare world. And that's why I started an agency. I started helping seniors 26 years ago. And in the last few years, when all the voices in the whole wide world are pushing only one thing, and that's Medicare Advantage, I failed to see the draw in Medicare Advantage, except for the massive amount of commissions that they throw at us, which is double in the first year of getting you onto those plans. But today I bring to you yet more evidence, not just from me and not my bias toward coverage versus insurance, which is what Medicare is. Medicare itself is coverage. Medicare Advantage is insurance, the old kind of insurance you're used to, where they try to spend the least amount of money on you as possible. You have to fight and claw and get things approved, get prior authorizations, get referrals, and get permission to have things done. That's insurance. Original Medicare is what you earned, and you give that up when you go with Medicare Advantage. And I know no one else is telling you this. I know how rare it is to have someone tell you this. So I'm going to share with you some other voices out there that you may not have been privy to before. One is from 𝗲𝗿𝗄𝗿. 𝗲𝗿𝗄𝗿 was an insider. He actually worked for the Medicare Advantage companies and got so disgusted with what he saw that he actually wrote a book about it. And here's 𝗲𝗿𝗄𝗿 in his own words.
Not even be called Medicare Advantage. It's not Medicare, nor is it an Advantage. So I think there should be legislation that should bar these companies from even using the name Medicare.
This is Democracy Now! I'm Amy Goodman with Juan Gonzalez. A major investigation by the New York Times this weekend has found many of the nation's largest health insurance companies have made billions of dollars in profits by exploiting the government's Medicare Advantage program. 8 of the 10 largest Medicare Advantage providers have overbilled the government. 6 of the 10 have been accused of fraud by the government or company whistleblowers. This comes as the number of people enrolled in the privatized system continue to grow. Projections show that by next year, more than half of all Medicare beneficiaries will be enrolled in a private plan. Under the system, health insurers get more government funding for sicker patients, which has given the companies an incentive to make patients appear more ill than they actually are. UnitedHealth, Humana, Kaiser, and other health insurance companies have been sued for fraud for overdiagnosing patients to bump up profits. The cost to taxpayers is staggering. Overbilling by health insurance costs the government an estimated $12 to $25 billion in 2020. The New York Times reports doctors at Kaiser were offered bottles of champagne and bonuses if they added additional illnesses to the medical records of their patients so the company could make more money. Joining us now is 𝗲𝗿𝗄𝗿, former executive for the health insurance companies Cigna and Humana. If you can start off by explaining how Medicare Advantage works. Many people might say, oh, they thought that was a government program for people 65 and older.
It's important to note that it is neither Medicare nor is it an Advantage. It is, I think, will be recognized in years to come as probably the biggest heist, the biggest fraud, the biggest transfer of wealth from taxpayers, middle income, low income Americans, from them to corporate executives and shareholders. It is a plan that has been in the works or has been around for about 20 years. It was born during the George W. Bush administration when Republicans controlled Congress and they were determined to start privatizing the Medicare program. And as you noted, now 20 years later is to the point that almost half, and in some cities and districts, well more than half already are enrolled in this program. It is a private program. It is operated by private insurance companies. They're lured into these plans with deceptive advertising. The plans feature things that are common in private plans but not in traditional Medicare, such as prior authorization. Doctors have to get permission in many cases from the insurance company before they can treat their patients. Inadequate networks, particularly as people get older and sicker, and very, very high out-of-pocket cost if people knowingly or inadvertently go out of network. So it is a program that absolutely should be called disadvantage.
He thinks it should be called disadvantage. And I've heard that so many times. If you read some of the comments that are on this YouTube channel, not just this video, but on the channel, you will see hundreds upon hundreds of stories of people who say the same thing. It should be called Medicare disadvantage. Now, Wendell was asked, why is it that no one is, they're like the fox guarding the hen house. Why is no one doing anything about this? And the answer may surprise you.
And Wendell Potter, it's to me, it's amazing. The healthcare system in this country right now, when you go to a general practitioner, they basically are constantly referring you to specialists who always then want to do more tests. And it's the testing process of all of these specialists that drive up these costs. And as you say, on television, almost every single night, there are ads trying to lure senior citizens into these Medicare Advantage programs, this privatization of Medicare. Why isn't the government exercising more regulation or control over this process, especially the one that, as the Times reported, piling on badly documented illnesses?
Well, it's not because Congress has never seen this kind of information before. Many governmental organizations and like the OIG, the GAO, MedPAC, which advises Congress on.
How many times have we brought this up? We brought this up for the last 3 years, and still no one in the media is talking about it. The Office of Inspector General report. You can see that if you've not yet seen it over on allaboutmedicareadvantage.com, allaboutmedicareadvantage.com. On
Medicare issues and payment issues, and the Department of Justice, which has intervened in a number of these whistleblower lawsuits against these companies. That's been something that's been going on for a long time. And there also, by the way, have been other important journalists who've taken this on and done this investigation, like Fred Schulte at Kaiser Health News, Trudy Lieberman at the Center for Health Journalism. So they've known this, but they've turned a blind eye in many cases because of the massive amounts of our money that these big corporations are spending to lobby Congress, to throw money into their campaigns for re-election, and to propaganda campaigns, and very, very misleading advertising, as you just mentioned. Open enrollment will begin in just a few weeks for Medicare eligible beneficiaries, and you will see just a barrage, a constant barrage of ads from these companies that they do not tell the truth. They leave out important details, like some that I mentioned earlier. So that's how they pull it off. Congress actually has given CMS more authority to crack down on this fraudulent program, but they've just turned a blind eye. That is a classic example of regulatory capture.
What is regulatory capture, Wendell?
What that means is that the companies, the corporations that administrative offices like CMS, the Center for Medicare Services, the Health and Human Services, they have such influence over these agencies that they don't act on behalf of Americans. They act on behalf of corporations to protect their profits. One of the administrators of CMS some years ago went straight from that job into the insurance industry as head of America's health insurance plans, which is called AHIP. They also have staffed, former members of Congress have staffed front groups for the industry. There's one called the Better Medicare Alliance. A former Pennsylvania congresswoman, a Democrat, was the first to head that up. So that's how it happens. There's this revolving door between private industry and government, and massive amounts of money that fund all this lobbying and propaganda.
Now, there's a personal story and a personal side to this. I'm going to share two of them here with you today, of how these people who are so passionate about educating you, the senior, and I'm glad that we're bringing it to our 52,000 subscribers so far. They're passionate because they've experienced it themselves. Wendell, from the inside of the insurance company, seeing repeated denials, prior authorization, and all the appeals. Here's his personal story.
𝗲𝗏𝗃, you had your own mother disenrolled from the Medicare Advantage plan over a decade ago. Why did that happen? And what was the impact on her health as a result?
This is something that every senior should know. These companies go after people when they're younger and healthier with kind of a siren call that you can enroll in these plans for no money. You can actually get money put back into your Social Security account, as we hear from people like Joe Namath and William Shatner and Jimmy J.J. Walker. But the truth is, as you get older and sicker, then you become aware of just the disadvantages of this program. My mother broke her hip. She needed to have rehab and skilled nursing services for a while. When we looked at what was available to her in the provider network, it was incredibly inadequate. So I worked with my mom to get her out of a Medicare Advantage plan. It was one that was operated by United Healthcare, and they market in conjunction with AARP, which is an outrage, in my view. But there's a problem there, because when you do that and you're older and you wait, years after becoming eligible for Medicare, it's harder and more expensive to get a Medicare supplement policy to help cover your out-of-pockets. So we did that knowing that. We had to pay a lot of money, but at least she was able to get the care that she needed at a quality facility where she got the rehab and skilled nursing care that she needed, which she would not have gotten had she stayed in that Medicare Advantage program. I'm confident my mom lived additional years because of what we were able to do.
𝗲𝗏𝗃, finally, what should Congress do to prevent this kind of fraud? And we're moving into the midterm elections. There is almost no discussion of Medicare for all in the corporate media. I don't know if it's because every 5 or 6 minutes they break for a commercial for some drug company, for some new illness that has been defined. But what has to happen right now?
Well, there are some important bills that have been introduced, and some I trust will be introduced before too long. Congresswoman Katie Porter from California has introduced an important bill that would force the government and force these plans to be more forthcoming, more transparent, to provide information and data that they're just withholding from the government. It should not even be called Medicare Advantage. Like I said earlier, it's not Medicare, nor is it an Advantage. So I think there should be legislation that should bar these companies from even using the name Medicare. There are some good members of Congress who understand this. Congresswoman Porter, Congressman Mark Pocan, 𝗲𝗏𝗃 𝗟𝗃, Jan Schakowsky, they're all aware of this, and they unfortunately are in the minority even among Democrats. But I think that New York Times story and some of the other things that advocates are beginning to do will wake them up and force them to get on the stick and do something. Congresswoman 𝗟𝗃 has been the lead sponsor, as you may know, of a Medicare for All bill. She gets it. Others get it too. But this is going to be an important step along the way. There's going to be a big, frankly, effort by industry to say we should have Medicare Advantage for all, which would be the greatest travesty I think that this country could ever experience.
𝗲𝗏𝗃, I want to thank you for being with us. We'll link to that New York Times expose.
So let me just interject here, because I've been accused of being both Republican and Democrat, when actually all I really care about is taking care of the people that I've served for 26 years. And that is you, if you're coming eligible or you're on Medicare. That's all I do, and that's all I know, is how to serve my people the best. So if there's a bill sponsored in Congress that's going to help protect them and add some accountability and some clarity to this confusing and misleading on purpose world, then I'm all for that. I don't care what the letter is after the name. I really don't care. I want somebody that's going to go to Washington and actually fight for and look out for the senior, and not the shareholder, not the stockholder, not the board member of an insurance company. That is absolutely a fact. I'm going to show you a bill that's being proposed and gathering some co-sponsors right now. Again, I don't care where it comes from, but this bill might get some traction and might help someone who's turning 65, brand new to Medicare, to understand that Medicare Advantage is not Medicare. Medicare Advantage is taking you off of the Medicare that you paid into your whole entire life. Medicare Advantage is not Medicare. Here's what we're talking about with the
Mark Pocan is with us.
You know, the problem with some of these Medicare Advantage programs, the fact that they're not Medicare, often they're shortchanging people from getting the actual care they need. And now I think a full majority of people in this country, or over half the people on Medicare, are on these Advantage plans that are really substandard. And so we had a lot of conversations and decided the best way to try to approach this would be to ban the use of Medicare in the names of these plans.
The word Medicare.
They can't be, so they can't be Medicare Advantage. They can be whatever they want to be, Blue Cross Blue Shield, whatever company has one. They can call it anything but Medicare. But only Medicare is Medicare. And we want to preserve Medicare because it is the best program that's out there. We should certainly try to improve it. You know, let's add dental and vision and hearing and other things to it. But to have this separate programming that doesn't provide the same quality of care as Medicare is something that I think a lot of people don't know about.
Yeah, a lot of people don't know because they're really, really misled by the fact that it's got Medicare in the name. Then the lobbyists on K Street in Washington tried to get it to be called Part C of Medicare. There's another part of Medicare called Part C. Part A is going in the hospital. Part B is outpatient things. Part D is a drug plan that's a standalone that goes with original Medicare. But let's call a whole new thing here Part C. But actually Part C pulls you away from A, B, and D because you're not having those anymore. And it's completely a replacement for original Medicare. So Mark here, the congressman, also has a personal story, which is what drove him to be such a strong advocate for getting something done. And I'm going to show that to you, but really quick before I do, can you do me just a quick favor? If you've benefited or liked at all the work that we've done to try to educate seniors, could you like this video? And that's just clicking the thumbs up button. It goes without saying you should subscribe for the new things that are coming out about Medicare that may impact you or someone that you love. So please subscribe, and you have to hit that notification bell and make it to all so you're aware of our next live streams that are coming out. And it's always going to be something new and interesting about Medicare. So thanks for doing that. But here's the congressman's own personal story and why this impacts him so much. And tragically, it's not as good as Wendell's story, but it was with Medicare Advantage.
Mom was one of those people. She passed in February. And when she was in assisted living a couple of years back ago down in Kenosha, Wisconsin, they identified some care that she needed that someone actually came right into the building and could have provided for her. But because she was on one of these Advantage programs, she couldn't take advantage of that. Only Medicare was going to take care of that. She would have had to leave the building to get some of that regular care, and she was not especially mobile and wound up not getting the care she needed. So, this is a story and probably one of the lesser stories of what some people have had. If they're out of network in one of these plans, they can get billed really big expenses. We want to make sure that we're doing everything possible to preserve, protect, and enhance Medicare. Medicare Advantage programs certainly don't do that.
So the legislation is called what?
Save Medicare Act.
Okay, and it is so far sponsored by?
Right now, it's Ro Khanna and I. So again, I think it shows how much this comes out of your program, Tom. The two members I think who are on the most having conversations talked about this. But to be fair, I think this is something that a number of us have had talks about, from people like 𝗲𝗄𝗄 and Jan Schakowsky and Katie Porter and many other members. We've been on calls at various times with CMS on some of these privatization schemes, and I really do believe there are schemes that are out there. But this bill, I think, is the first ever introduced to kind of go after this, right? To make sure that they can't get away with this. And I think the most direct way to do that is let's just take away their ability to pretend that there's something they aren't, which is Medicare.
Yeah, so hopefully that gets some traction and actually might go somewhere. I just encourage you to do this. That is, find somebody that's passionate about looking out for you. It may be me. It might be some of my friends that are on YouTube that have a similar disposition, and that is not, we're just not lukewarm and vacillating from one side to the other and just have no position on anything whatsoever. If you want a Medicare Advantage plan, yes, we'll help you, but we'll also do it with a heart of looking out that you don't get screwed over or scammed. And how do you do that? There are better plans than there are lesser plans. There are plans that are more suited for you than potentially others. And rather than just being an application writing outfit, which we are not, we're actually going to listen to you and your health and your location and see what's available for you. And we help people with Medicare from coast to coast. It doesn't matter if you're in California or Florida or anywhere in between, we can actually help you. Let's say that you have an agent that you signed up with because you walked into a Walmart and there was a table sitting there and you just walked over and signed up for the first plan. I guarantee you it's a Medicare Advantage plan, because 90% of the agents out there today, especially the new ones to the business, unfortunately, are not presenting anything other than Medicare Advantage. They're not even telling you that a Medicare supplement exists. Again, look at the comments on this channel and you'll see hundreds of examples of that. Seniors turn 65, 66, 67, having never known that they could have enjoyed the original coverage provided by the Medicare that they paid into their whole lives. They were told, when you get on Medicare, you join one of these plans. You join a Medicare Advantage plan. They never had the choice. The unfortunate reality is, if that was you, you signed up for a Medicare Advantage plan when you're 65, then to go back to original Medicare, which you can do it during AEP, that's this period of time from October 15th through December 7th. You also have another period of time that you can do that from January 1st to March 31st. They're calling that now the open enrollment period, where you could leave Medicare Advantage and go back to original Medicare. But if you want to enjoy a Medicare plan, that's original Medicare, that is, with a Medicare supplement that fills in that other 20%, it plugs the holes of original Medicare, making it a complete system. You have to qualify by answering health questions if you're outside of your initial election period. So you may not be able to do that ever again if you were swiped into a Medicare Advantage plan when you first got on Medicare, and now it's years later, and you're just now discovering what you got with that free plan that someone was kind enough to sign you up for a commission of $750 to get you onto that plan, and then they're paid on you for the rest of your life on Medicare Advantage. That's the little sneaky part that I was quoted in a national story recently where I showed the commission, which no other agent has ever done publicly. You can see that research and you can see that information on a website called allaboutmedicareadvantage.com. I encourage you to go there. It's allaboutmedicareadvantage.com, and I'll continue to populate that site with news and things coming out about Medicare, and you'll have links to the live streams and all that kind of stuff. You can watch the past broadcast on allaboutmedicareadvantage.com. God bless you. Thanks for watching. Please share this information that's valuable with someone turning 65 so that they can know the differences between original Medicare and what your options are before you get rid of those options and just went to a Medicare Advantage plan for the rest of your life. At least you owe it to yourself and to them to give them both sides of the story, which is something that we can do here. Thanks for watching. God bless you. Bye-bye.